Hey there, it's Dr. G with a special message for you. As the founder of FCMW, I make it a priority to offer you the very best medical advice tailored just for you. With that in mind, and since we are in the last days of Breast Cancer Awareness Month, I wanted to remind you of the current recommendations by the American Cancer Society for breast cancer screening. It has been proven over time, finding breast cancer early and getting state-of-the-art cancer treatment once breast cancer is diagnosed are two of the most important strategies for preventing deaths from breast cancer. Meaning, breast cancer that's found early, when it's small and has not spread, is easier to successfully treat. Breast cancer screening is even more important now since the COVID-19 pandemic and when non-emergency procedures were being put on hold, leading to substantial decreases in cancer screening in general. So let's get back into it and talk about what the guidelines say for women at average risk for breast cancer. What's average risk mean? For screening purposes, a woman is considered to be at average risk if she doesn't have a personal history of breast cancer, a strong family history of breast cancer, or a genetic mutation known to increase the risk of breast cancer, such as the BRCA gene, and has not had chest radiation therapy before the age of 30. So once we determine that you're at average risk, what do we do about it? Women between 40 and 44 years of age have the option to start screening with a mammogram every year. Women between the ages of 45 and 54 should get mammograms every year. Women 55 and older can switch to a mammogram every other year, or they can choose to continue their yearly mammograms. Screening should continue as long as a woman is in good health and is expected to live at least 10 more years. All women should understand what to expect when getting a mammogram for breast cancer screening, meaning what the test can and cannot do. Clinical breast exams are not recommended for breast cancer screening among average risk women at any age. Research has not shown a clear benefit of regular physical breast exams done by either a health professional, such as myself, called clinical breast exams, or by women themselves, called breast self-exams. Women should be familiar with how their breasts normally look and feel and should report any changes to a healthcare provider right away. That's not to say I will never offer you a breast exam in the office. I may offer a clinical breast exam to you if you are at higher risk for breast cancer. I will go over the approach with you individually if it applies to you, but generally, if your lifetime breast cancer risk is greater than 20%, you will fall into the high category risk. I will go over the approach with you individually if it applies to you, but generally, if your lifetime breast cancer risk is greater than 20%, you fall into the high risk category. Risk itself is assessed by gathering personal and family history and entering the data into a risk assessment tool. That's some of the information I'd like for you to have as a member of FCMW, and please give us a call and let us know if you'd like to schedule your mammogram this year.